Beautiful time we're having right on the program, right here. Now, we want to go talk about something very crucial. You can all know that this is an issue to talk about, and it's about the residents' doctors' strike. One of the things that a lot of people use to express grievances, especially workers in Nigeria, is strike action. And it's as if we have a government that listens more to strike action than maybe meeting the needs of Nigerian workers ahead of time. A lot of damage controls have been done in the past instead of just ensuring that the damage is not being caused at all. Joining me on the conversation is Dr. Joseph Agogo, and Dr. Joseph Agogo is joining us all the way from Federal Medical Center in Makurdi. Dr. Joseph Agogo is a senior registrar at the Federal Medical Center in Makurdi. Is senior registrar obstetrics and gynecology. All right there. It's good to have you join us on the program this morning, Doctor.
Thank you for having me in your station.
Hello, Doctor. Can you hear me?
Thank you for having me in your station this morning.
Oh, all right.
Good morning, our out there.
Okay.
As he rightly introduced, Dr. Agogo Joseph Fiji.
Oh, okay. Let's get into talking about the strike action now. Resident doctors are striking, and of course, our federal government pledges a 72 hours resolution. Why is the strike still on after the promise by the federal government?
Well, the issue of a strike in Nigeria has actually become something very, very appalling. It's a very, very bad thing, but regrettably, the only language that the government of this country understand or listen to is strike. Strike, especially by the health workers, is not anything that any of us is happy to embark on in the first place. But when there are some compelling reasons and circumstances, and the only option you have to is just strike, you have no option than to resort to it. That is exactly what is happening. We feel the pains of our patients, the patients, the less privileged patient, the patient that do not even have the financial wherewithal to afford private care or even fly abroad, as like our politicians will always do. It's actually a very regrettable situation. Like the government, when you go embark on strike like this, those strikes, we do not just stand up one day and embark on those strikes. We normally, before we embark on those strikes, give an ultimatum, a time frame in which some of those our demands and resolutions should be given the needed government attention. But government, because of the fact that there is no any iota of sincerity on their side, they do not even want to do anything. They will prefer to just give lip services. They will promise something and they will never do it. They will give you all assurances, and when you return back to the hospital to work, they will just go back and forget about everything. This strike that we are back on, it has actually something. There are issues that have actually lingered over several years. It's not just something we just stood up and embark on the strike. Okay, now take for instance, you are not telling me that they have given a promise that they are going to resolve everything within 72 hours and doctors resort to work. That is not possible. That is not realistic, and that there's no element of truth in that statement. Because some of those issues that we're back on strike on, there are plenty issues that cannot just sit down one night and then try to say they have resolved all of them. It is not a monetary gain alone. It is not a monetary issue. There are infrastructural issues, as well as the issue of stripping the resident of their well-deserved status, and so many other things that they need to sit at the round table and discuss, negotiate them, and then try to see how to find a common ground that will appease the doctors. So it's not just something about that, okay, we have received several billions that the doctors will go back on to work. It is not all about money. There are so many other issues that are involved. There are issues of issues that concern even a shortage of manpower, acute shortage of manpower in the health sector. So these are some of the issues that the government should, with all sincerity, sit down on a round table with those doctors and see how to iron it. There are plethora of issues on science.
But then, as it is right now, Doctor, government is putting off an offer of some billions to handle this situation. Don't you think that's reasonable enough?
Well, it is, as I earlier told you, it is not about a monetary offer. Yes, the strike we embark on is not, as I earlier told you, it's not only a remuneration related issue. There are a lot of issues that border on the welfare of the doctors, the resident doctors in particular, and also that will give them the opportunity or give them the morals that will be able to offer effective services that will improve the outcome in the health sector. These issues are not just about government have sat down and say, okay, they have received a 2 billion, they have received 3 billion, or whatever, that the doctors should go back to work. It is not all about that. And another point to note too, some of those money that have been released, or they say they are releasing, they are not just only from resident doctors, they are for all the health, all the staff working within the health sector of the federal government. So it is not all about resident doctors. As resident doctors, we have our own peculiar needs, peculiar issues that prompted this strike that we have embarked on. Those issues have not been listened to. The government have not sat down to hear from us or try to give the needed attention to some of those problems. So it is not about the money. It is not about remuneration. There are plenty of issues, as I told you. It's not about this money that we giving out. Yes, we do not reject the money because it is our entitlement. It is something that we have already that we're even long overdue. It is just because of the fact that there was no sincerity on their part. That is why, take for instance, the allowance of 35% that pay now. It is something that was due since 2023. The government reneges on the promise of paying their money, and it is only when you push them, they will just try to come out and give you something, which is not supposed to be so. So it is not that we are this money are just given to us like a kind of bonus, or try to make us happy, or try to pacify us, or try to bribe us to go back to work. No, it is our legitimate entitlement, and those monies are long overdue. They are supposed to be paid long ago. It's supposed to be delayed to this extent. So it is not about monetary issue or whatever.
All right. Dr. Joseph, there is something I saw on your status where that statement, that write-up was speaking to Nigerians, letting Nigerians know what doctors are going through. Like you talked about the fact that it is not all about the monetary benefits alone. I saw a situation where you were talking about using, is it a torchlight, to carry out your operations as doctors. That caught my attention. I can't really remember everything that was on that your status, but it was a write-up telling Nigerians of what doctors are going through. Can we have a snippet of those things?
Well, as you rightly asked, as I told you that it is not about monetary issue, we have a lot of infrastructural deficits. Most of these hospitals you are seeing, the federal government hospitals, as the state or the state tertiary institutions, most of them are eyesore. If you see some of them, the environment alone does not depict that of a tertiary healthcare institution. Some of them, the basic infrastructure that you even need to work as a doctor are not there. Sometimes even power issue is a very big problem. You be on duty, the power supply is so epileptic, sometimes you don't even see at all. Sometimes you have to even struggle to use your phone or touchlight to see how to see your patient, to consult with your patient with your phone light and the rest. So there are a lot of infrastructural issues that the government need to sit up and give those hospitals a needed infrastructural facelift. So as a matter of fact, there are issues. Sometimes you know what to do, the knowledge as a doctor, but you don't have the equipment, the needed equipment to save the life of your patient who is dying. So there are a lot of issues that the government need to sit up And unfortunately, they're not doing that. But that's because of the fact that they have better alternative abroad, where before you know, even if it is just common headache, they fly abroad with our taxpayers' money. And because of that, they do not want to see that to fix the health sector of this country. So it is a very appalling situation, and something has to be done.
All right, I'm talking about trying to save life now. Let's look at this critically. Nigerians are also feeling bad that the doctors are striking. Now, the question I want to ask is this: how do you plan to ensure patients' safety and well-being during this strike, particularly those that are having critical situation? Because I'm aware that in some hospitals in Nigeria right now, we may have people at the intensive care unit. How do the doctors, all right, plan to take care of these people who are innocent, all right, of what is happening right now between the doctors, resident doctors, and the federal government?
Well, before I answer that question, let me just give you basic information you need to know about the resident doctors. As we embark on this strike, as I told you, that we share in the plight of our patients. Patients are actually the ones to suffer it, because it's like a case of two elephants fighting and the grass is we the one to suffer. That is exactly what is happening here. Although we are not elephants, it's only the government that is the elephant by trying to fight the doctors anyway. The issue is that the resident doctors, we are the one that form the backbone of the work in the tertiary healthcare institutions. We constitute about 60% within the tertiary healthcare institution. The fact that we have gone on strike now does not mean that we have closed down. The hospital has been closed down. We have the consultant on duty. The consultant actually they are the ones that own those patients, but we were the one that see them day to day, interact more with them, see their condition, and then present them to our consultant, who are like our supervisors. So in times like this, the consultant supposed to come in and step in and see what they can do, even though their number is very, very small compared to the number of the resident doctors. And they may not be able to do even 1/4 of what the resident doctors are supposed to do. So in the end, most of the patients will still suffer it very, very well. So patients are actually, as you said, as you know, patients are actually going to suffer. Unfortunately, too, the doctors, the resident doctors who have become the backbone of this workforce, have also been suffering. And before you can offer a very effective and qualitative healthcare service to your patient, you too as a doctor, you need to be fine. You need to be well motivated. Your welfare has to be taken care of. You have to be given an optimal environment where you can offer your best. But all of those things are what the federal government have deprived us of. Yes, we've been trying by all means to ensure that we give out our best. Unfortunately, the government is not encouraging us to give us our best. Even what is duly yours is not given to you. So what do you expect us to do? It's like you pushing. If you push a goat to the wall, the goat, you have no option than to show you that I have teeth to bite. So exactly that is exactly what is happening. Like, we are not happy with what is happening. We are not happy at all. Our patients are suffering it. Family members too, one way or the other, they are suffering it. Friends, relatives are suffering it. But we have no option than to embark on this, because this is the only way we will strive to ensure that the soul of the comatose healthcare system of this country is revived.
So now, what do you think are the expectations, all right, of the resident doctors from the government? If what the government has done so far is not satisfactory to the doctors, what is your expectation from the doctors so that this strike can be suspended ASAP? And the reason I'm asking this question is because I know a lot of Nigerians on social media everywhere. A lot of people are going to be writing so many things, so that at least if anyone wants to contribute to the situation, they will know what the doctors want at this point in time for this strike to be suspended for the sake of those in critical situations in the various hospitals.
Well, thank you for this question. As a matter of fact, we have a minimum demand for this strike, and our minimum demands are So, and this minimum demand, but it should be all or none, or at most up to tonight agreed upon, or something has to be done tangible about those 19 demands before we resume back to work. Because as I told you, it is not about the money. It is not about paying the outstanding areas. But there are so many other issues. Take for instance now, let me tell you, I'm a senior registrar. Earlier this year, I went for my part 1 exam. I passed the exam. And by virtue of that success in the exam, I'm now a senior registrar. Up to now, my advancement as a senior registrar has not been done because of some bureaucratic bottlenecks. They will tell you that the IPPS office in Abuja is here to do it, that they have centralized it, they have not been able to ratify the upgrade or whatever. This is one of the issues. Another issue too, as by virtue of this qualification, I am supposed to be given a specialist status. That specialist status comes with allowance, some special allowances that is attached to it, because I offer specialized services. So I deserve this. And unfortunately, the federal government sat down unilaterally on their side and tried to downgrade that status, downgrade that qualification with no benefit. And it is not supposed to be so. Like other neighboring countries, by the time you become a senior registrar, you are ordered that specialist status with associated specialist allowance. But that is not done here. When we complain, they say that it was part of the routine government activity. Why will a routine government activity try to bring down people or something that has been the status quo, and they try to bring it down? Most especially that we are very precarious state of the in the health sector, where we have a high level of brain drain. A lot of doctors have left the shores of this country for greener pasture. A few of us that have decided to show some level of patriotism or sacrifice for our nation to try to stay behind, instead of them to try to encourage or give us some incentive, they are rather depriving us of what is legitimately ours. And how do you think that the doctors, the morale of the doctors, yeah, to work? So these are some of the issues. It's a very, very painful and very pathetic and appalling situation that we are crying to the entire world, to Nigerians. Let Nigerians equally join us in this struggle. It is not all about the struggle to give us some financial benefit, but it's a struggle to save the healthcare sector of this country from collapsing. Because our government are not doing much at all. That is just an obvious and painful and regrettable truth.
All right. There is something you said that caught my attention. That's the issue of the fact that the consultants are few and they are not up to the numbers of the resident doctors. So now that resident doctors are on strike, it means some persons may lose their life or their situation gets deteriorated. Now, we also talked about the fact that your current status does not come with some of the necessary benefits that are supposed to come with it, like it's been done in advanced countries. And that brought my mind to the issue of brain drain in our health sector. But the federal government, on their own part, have been doing everything and preaching the gospel of doctors shouldn't leave the country, and even doctors that have gone should try and return back home. Now, what do you think about the stand of the federal government and the issue of brain drain in Nigeria?
Well, as I like say, brain drain, if I give you the breakdown of some statistics, in the last 10 years, we have over 16 resident doctors at the federal institutions. Right now, as I'm talking to you, we have less than 9,000 of those doctors at the federal institution. Then at the state institution, tertiary institution, we have less than 1,500. And then some of those private institutions that offer residency training, we have less than 200 doctors in those facilities. To let you know that the brain drain has really affected the health sector. And the question you ask is that, do you blame those doctors? No. Because those doctors are not giving the needed attention, they are not giving the needed welfare benefit that will encourage them. Yes, you should ask me so that being a doctor, you are not supposed to amass wealth. We are not trying to amass basic minimum, basic welfare package for us. Government is not doing anything to that. Most of the things you hear them say is just lip services. They do not match their words with a commensurate action. Some of those things, they only just say them to like curry some political favor to themselves and win an election for the next or whatever. They don't say some of those things from their heart. They don't do the necessary thing to ensure that the infrastructure facility is given to the health sector to encourage the doctors to stay and work. You may hear them say, yeah, that doctors need to come back. It's not about saying it. It's not about.
All right. It's not about saying.
It's all about
okay.
to come back. But as I'm talking to you, there's nothing that the federal government is doing in that direction. And it is a very regrettable situation.
Oh, all right, Doctor.
So as it stands, stance of the government, that stance has been so encouraging to curb the menace of brain drain. They have not done anything to encourage doctors to stay behind, or those people that are outside to come back, as I earlier said.
All right, Doctor, this 72 hours, all right, are being given by the federal government to resolve the situation. What should Nigerians be looking out for as it has to do with the outcome between the resident doctors and, of course, the federal government, who have promised 72 hours to resolve the situation?
Well, I'm not part of the federal government. I am on the part of the doctors. I'm a doctor. I'm also on the part of the doctors. I cannot speak for them. But I don't know what they have, the plans they have. I don't know how they're going to go about it. But yes, they have all it takes. If they want to resolve all those issues, even just within some hours, they can do it. So they have everything it takes to resolve those issues. But as I told you, I will assure you that our members, if those 19 demands are not given the needed attention, I can assure you that even the 72 hours window that the federal government promised, if nothing has been done tangible, I assure you that our members will still remain on strike until the needed attention and needed things that is expected by the federal government is done. Like I assure you that the strike will still continue. It is just a promise on their part. But let us just see how they will be able to match that their promise again with their necessary action.
But if they are not able to meet all the 19, and maybe a part of it is being met, let's say maybe 80%. What do you think if they are not able to meet the 19 points and they go like 80% or 85%? Would the doctors consider, because of the patients, of course?
Well, the fact is that we have always been considering our patients. Yes, I know that when you go to a negotiation, 100% of what you want, but there are but in all of those issues, as I told you, they are very, very important issues. They are not financial benefit alone. There are so many other issues. Like, take for instance, there were some doctors that were unjustly sacked just because they were fighting for improved welfare for their members in Federal Teaching Hospital, Lokoja. Those doctors were sacked. Part of our demand for this strike is let the government reinstate them. There's excessive workload among doctors. You see a lot of doctors working, doing calls almost every day in the month. So because of the stress, even recently there was one of our colleagues, a resident doctor that collapsed and died in Port Harcourt. There are plenty of issues that all of those issues itemize, all those 19 issues. In fact, I don't even know which of them is more important than others. But all of them are very, very important. The government have to give all of them the needed attention. Well, as far as this strike is concerned, our minimum demand is 19.
All right.
That's our minimum demand.
All
There are things
right.
that the government can do if they the commitment and sincerity. They can do. They can. It's something they can resolve within a short time. They
All
can
right,
do them. It's
all
not
right,
beyond
Dr.
them.
Joseph. Thank you very much, Doctor, for joining us today on Global Morning, all the way from the capital city of Abuja. You joined us from the capital city of Benue State, which is Makurdi. Dr. Joseph Agogo is a senior registrar obstetrics and gynecology, Federal Medical Center, Makurdi. So many thanks for joining us on the conversation today.
Thank you very much. Thank you for having me in your studio.
All right. Thanks for joining us. So much loaded for you today on Global Morning. Stay with us.